Namaskar. You are watching Dr. KK Med Talks Fridays with Dr. Anita Kant, non-stop show, 1122nd episode. Let's have the headlines of the day. Globally, a woman died every 2 minutes in 2023 from pregnancy-related causes. In 2023, over 700 women lost their lives every day due to preventable complications related to pregnancy and childbirth. Studies show that cervical cancer during pregnancy significantly increases the risk of poor maternal outcome. According to WHO, C-section birth now account for 21% of all deliveries worldwide, with projections estimating a rise to around 29 by 2030. A recent study revealed that 1 in 5 babies in India are born by a caesarean section, with rates notably higher in private hospitals compared to public facilities. Let's go to the topic of the day. So, cesarean section or normal delivery? All of us want normal delivery, but many of the girls today don't want to take the pains before the normal delivery. So, we will be talking today about some myths, and these myths will be broken by Professor Dr. Madhulatha Alexander. So, she will be telling us what childbirth is all about and why cesarean, why normal, and whether we choose or it's a nature who chooses, and how do you go about planning more healthier mothers and healthier babies. We are pleased to welcome Professor Dr. Madhulatha Alexander, an esteemed clinician and academician in the field of obstetrics and gynecology. She holds an MBBS and MD in obstetrics and gynecology and currently serves as a professor at the prestigious Osmania Medical College, Hyderabad. With years of experience in clinical practice, teaching, mentoring, she has played a pivotal role in shaping the next generation of OB/GYN specialists. Her contributions to women's health, particularly in maternal care and high-risk obstetrics, have earned her immense respect in both academic and clinical circles. It is a privilege to have her with us today as we look forward to gaining valuable insights from her expertise. Welcome, ma'am. Welcome to our show.
Thank
And
you.
I hope our listeners are going to gain a lot, like me, from today's show.
Thank you so much, ma'am.
So, shall we start?
Yes.
So, is a normal delivery, that is a vaginal delivery, always safer than a C-section?
See, from times immemorial, a normal delivery has always been the norm. Cesarean section has come only recently. Okay. And we know that a lot of women were lost in childbirth. And many times this could have been preventable nowadays. Sometimes nowadays, when you know normal delivery is actually becoming up now, because if you see the rising rates of cesarean section, with the safety of the section, anesthesia and pediatric care, it is rising, especially in the cities that we all come from. I work in the public sector. In our hospital, it's around 40 to 45%. But in the state that I stay, it's a dubious distinction of about 50 to 55% is cesarean section rate. Now, it's definitely safer because at the end of normal delivery, the mother has less morbidity, early recovery, and there's no scar related. So she's able to enjoy the experience of childbirth and as a mother. But in all situations, it's not always safe. Like, for example, in the case of a breech delivery, cesarean section is always preferred. And nowadays, with the increasing sections, we are having the obstetricians might the plus acquita spectrum. So in these conditions also, we have to do only one for cesarean section. Sometimes in twin gestation, when there's only one aortic tract, even in these patients, we have to go in for cesarean section. If there is fetal compromise or obstructed labor, there are so many conditions when cesarean is always preferred to a normal delivery. But there's no doubt, if there's an option, always normal delivery is the best.
So, are C-sections nowadays only recommended in emergencies?
No, actually, kinds of cesarean section, category 1 and category up to 4. The first one is one in which you have to do is a cross section. You have to do it immediately because both either the mother or the baby is at risk. Okay, and the category 4 is elective one. That is, sometimes we have to compulsory deliver the patient by cesarean section. Like, for example, as I told you, breech, all these, all the indications that I mentioned already, these we have to go elective. But there are advantages also of elective section, because in this we know the patient has to be delivered on a particular day. Patient is fasting, the anesthetist is there, he's at hand, he's prepared, and also the pediatrician is at hand, the senior obstetrician is at hand. Selective section is when you plan a cesarean section. There are indications, and also it is recommended in certain situations. But many cesarean sections are done also as emergencies.
Nowadays, girls will always opt for normal delivery, especially in their first time. They are so full of, I want a normal delivery, but then they don't work out. They don't do any work at home. They are not doing any yoga or any workouts, and they eat like there's no tomorrow. You know, all the things which are really not all the time good for the mother, they are eating that. Baby weight within the last month process from 3 to 4 kgs, and naturally they land up with a cesarean. And then if they at all opt for a c-section, they feel I have failed at natural birth. So why does that happen?
Yeah, see, there is nothing like a failed cesarean section. See, every mother wants to have a normal delivery, but sometimes it doesn't work out. So we should not be using the word failed. Okay. Now we have a section. It is called a previous. If you had a previous delivery, the section is called a previous section. So this time you can opt for a VBAC, a vaginal after section, or this time certain indications you have to go in for a section. Then it's called elective. Elective repeat cesarean section. So another category, which is actually a failed VBAC. That is, you are trying for a vaginal delivery after cesarean section, but didn't work out. So just to keep these mothers assured that don't think it's a failure, a new terminology has come called CBAC, cesarean birth after C-section. This category that has a lot of problems, a lot of morbidity, and we try not to get into this group, but still always if you want C-section, we don't always are successful. So therefore, the mother should be given reassurance. There's nothing like a failed section. She should be given reassurance. She had done her best, and not to worry. And also, main thing is, we should also counsel her about her future pregnancies, how her body will recover. She needs a lot of counseling. So there's nothing like a failed pregnancy nowadays. Okay.
Can a lady choose a cesarean section even if there is no medical or obstetrical reason?
Yes, that is called a cesarean section on maternal request. Nowadays, even WHO and all the bigger centers have accepted that a woman has a right to choose a cesarean section. But what we as obstetricians should do is we should counsel the patient that in her situation, probably that's not the best idea, because not only is that there may be problems, whatever it is, cesarean section is a major operation. Anytime you can land up in problems. Also, for future fertility, your future pregnancies, all will be affected. But still, if the patient insists on it, there's something called tocophobia, that is, doesn't have pain in delivery. Now, this patient has to be counseled, but still, if she wants to go ahead, you have to respect her wishes. And in case you are not comfortable, you can refer her to an obstetrician who will do it. Yes, you can opt for it, and this is an entity nowadays.
And is recovery always faster after a normal delivery than after a C-section?
Usually, yes. On the whole, yes. Recovery is faster, recovery is better, because there are no sutures and you have not gone through a major problem. But it's not always the sometimes vaginal deliveries land up in a big mess. And we sometimes we have to put instrumental deliveries to deliver the baby. They can be big tears, they can be 4 vaginal tears, perineal tears, and this can be very morbid. It can cause a lot of problems to the patient. So it's not always a situation that is better, but yes, most of the times the normal delivery is better than a cesarean section.
And does a cesarean section hurt less because of anesthesia?
See, the second section, when we are doing it, it's only about maybe 20 to 25 minutes. That time, we give very good anesthesia to the patient. Okay, so that time only the patient is not going to have pain. But post cesarean, she's going to have a situation in which the pain intensity compared to normal delivery is much more. Pain will be more, pain will last for longer time, and she'll have a lot of problems. So it's only you can't go on saying I don't want pain, because finally, if you see, the intensity and duration of pain is much more in a cesarean than in a normal delivery. This should be explained to a patient, especially if she is opting for cesarean section.
And will a cesarean section affect a lady's ability to breastfeed the baby?
See, cesarean section has its own problems, because when you deliver, when the patient delivers, there is, when she goes into labor normally, there is a prolactin oxytocin surge, which takes time, and at the end of labor, the surge peaks and the patient starts lactating in normal labor. But in cesarean section, immediately the patient, the baby is brought out. There's no time for the surge, there's no time for the hormones to act, but the breastfeeding hormones to start acting. So there will be a delay. Not only this, the patient after the session, she will be in anesthesia, she will be in pain, and she will not be able to feed the baby immediately. But nowadays, to avoid this, what we are doing is we allow the baby to be kept on to the mother's skin to skin contact. This helps. We delayed, we clamped the cord a little later. All these small things help. And also, the baby is kept next to the mother unless necessary. So all this rooming in, all these small tips, the mother to lactate, to feel better and more complete.
And is a vaginal birth riskier for the baby than a cesarean section?
See, vaginal birth, as I told you, is always best, because when the baby goes through vaginal, the birth canal, there is catecholamine surge. And because of this, the lungs get cleared. Okay. And so vaginal births have this transient tachypnea of the newborn, and also all these things will be less. And not only that, when the baby goes to the birth canal, he or she also gets the flora of the mother. All these help in the building up the immunity of the baby, and also childhood asthma are less in babies who have had normal birth. So yes, vaginal birth is good for the baby. It does have effect. It's not always possible to have vaginal births.
And can vaginal birth cause long-term pelvic or sexual health issues?
Yes, it doesn't always cause, but it does cause sometimes, especially as I told you, when there's a traumatic vaginal birth. Then it can cause chronic pelvic pain. It can cause problems in sexual activity and sexual health. The patient has sometimes a third or fourth degree perineal tear. That morbidity is very, very intense. So these definitely may cause long-term pelvic problems, pain, and problems in sexual activity.
And C-sections are always safer for babies in breech position. One should not opt for a
Yes.
normal delivery, vaginal delivery.
Yes, in a breech delivery, there is no doubt. It is definitely better. The problem is the baby's bottoms and the legs will come out, but the head can get stuck. And for this, the obstetrician will start pulling. There are maneuvers which you can do, but still, if there's a delay, there will be delay in oxygenation. The baby may be slightly retarded, which we cannot accept nowadays. There may be a policy, so maybe so many things. And always a preterm breech is more traumatic, so you have to do a breech. Only sometimes we give a vaginal delivery for breech, that second of twins, because usually the first twin is a bigger baby, it comes out, and then you're not really anticipating the second baby being the breech. There's very few conditions we do give a vaginal delivery for breech nowadays.
And they also say that C-sections reduce the risk of birth trauma to the baby, because they feel that maybe during the vaginal delivery, sometime instruments are going to be used and all that, and there can be a risk of birth trauma.
No, main thing is mommy, one, please go, mom, please go. No, one thing is, mommy, you're in the TV, please go, please can go, ma. See, main thing is when you are having a breech delivery, any delivery, she's having the transverse lie. Okay, in the transverse lie also, there may be shoulder dystocia, the baby is big, there may be so many problems, the baby is big, etc. So in these patients, it is necessary to do a vaginal delivery. It is necessary to do a cesarean section. There are advantages, yes, and we have to go ahead. The question, madam, what did you ask? Actually, sorry, I got a little distracted.
Okay, so no problem. I was just
Yeah, yeah.
asking that, sometimes even if it's a normal vaginal delivery, the pediatrician will say that baby is having problems due to birth trauma. So will cesarean section
Yes.
reduce this risk of birth trauma?
Not always. Yes, it will reduce to a large extent, but not always, because even in cesarean section, we have delivered breaches, we have had we had fractures of the humerus, etc. But yes, definitely, at least it's in our control. But trauma has happened both in cesarean section and in vaginal deliveries. It can happen,
And
but definitely to
it
a
can
lesser
happen.
extent in cesarean sections. Yes.
So how does age of the patient or her health conditions like diabetes or hypertension affect the choice of delivery method?
The age of the patient. Along with age, we also have problems like blood pressure. So these patients have more chance of getting pregnancy, hypertension, eclampsia, etc. Now, also when a patient is older, the threshold for us making the decision to do a section is much higher, isn't it? The patient doesn't have
Yes.
much chance of having another child. She may have had a late marriage. She may have had conception with assistance. So these patients are more tempted to go in for a quicker decision for cesarean section. Also, if these patients will have other metabolic problems, like blood pressure, diabetes, etc. And in diabetes, we know the problem. The patient can have a stillbirth, patient can have macrosomia. All this can cause problems. So we have to be very careful and we have to make the right decisions. And as I told you, older age group do have issues, do have medical issues. And therefore, we have to be very careful and we take quicker decisions in these patients.
There's a lady online who's asking that she was 42 years old when she had her first baby, and the doctor told her that her pelvis is somehow not flexible enough to bring out a baby of 3.5 kg weight. So she was asked for a cesarean. So, what do you have to say to this?
See, this lady, you said, madam, said this lady is 42 years. See, if this
Yes,
lady
ma'am.
was 42 years
First
having her
baby.
first child, first baby,
Yes,
even
ma'am.
I would
Yes.
be more inclined to listen to the patient because this may be her only chance of being a mother. So, in case she had all these doubts, in case, supposing at the time of the delivery, I assess her pelvis, baby is okay, then probably I would give her a very short trial under supervision and I would make a quicker decision to go ahead for cesarean section.
Right. So, it is not true that doctors push for cesarean sections for convenience or money, or is it?
No, definitely not. But nowadays, what happens is we are having a lot of patients asking. We call them in the place where I'm Hyderabad. We call them Muhurtam sections. They want their
Yes, yes,
baby
yes.
to be born at the particular time. I don't know. Many patients want, and it's difficult to actually convince this patient that it's not always right. But I must tell you one thing: most doctors prioritize patient safety first. We follow patient safety, we try to advise the patient what is right, and we try to give them evidence based information. And still, if they insist, then in the private sector, many patients are being forced, the doctors are being forced to do sections at that time because if you don't do it, some other doctor does it. But it is our duty to advise the patient what is right.
Yes. Actually, they not only ask for specific timings, they ask for odd hours. So many doctors who are
Always.
busy elsewhere, they will say, okay, I will cancel my OPD and come. And that is where the factor of money comes in. And that is actually put forward in a way that doctors are charging more money. They forget their part of the
Mm.
story. So another
Yes,
lady is
because
asking,
yes.
yes, ma'am, Boli,
Yes,
because,
ma'am. No, no, go ahead. No, we look after the patient for 9 months, and they're
yes,
almost like family. So
yes.
we get very close to these patients. So sometimes we do entertain these people.
No, not only 9 months, they come to us again, and sometimes it's the mother
Mm,
whose child was born with me, and now the child has come for another baby, and it's a family association.
family
Even if
affair,
we
yes,
don't
ma'am.
remember, they remember, and they come and remind us. So it's very difficult to say no to them. I agree about that. Um, a lady is asking, can I have a vaginal birth after a previous C-section?
Yes, you can. Now, it all depends on why the previous section was done. After one section, yes, you can. There are certain factors, okay? That is, if the inter-pregnancy interval was at least 18 months, at least 6 months, and also if the previous was, it was only one cesarean section, there were no previous scars on the uterus, and there are so many other points that, and actually there are at least scoring systems. But these scoring systems, when you put these points into that scoring system, it's only when the patient goes into labor. So that's why there are a lot of pitfalls. But there are certain conditions in which you can repeat the section. But if a patient has had two sections, better to go for a cesarean section. But sometimes we do. As I told you, if you have an elective repeat section, it's okay. But if these patients we think of having vaginal delivery, if they have a failure, they have more problems. The problems being these patients can have huge rupture of the uterus, okay, when the muscles start giving way. That is one problem. Or sometimes they'll have dystocia, whatever reason. You should be careful. They should be monitored in a good center. They should be in a place where we can immediately convert this patient to a cesarean section. Okay, it's called a crash cesarean section. Unless you have
Yes.
your SHS on hand, unless your doctors on hand, then only you're justified in doing the trial for this patient. Otherwise, better to go in for repeat section.
So many women say that labor pains are unbearable. That is why they choose to go for a cesarean section. So can something be done about making the labor pains bearable?
Yes. Yes, I think a lot of counseling these patients need, because labor pains finally is bearable. But what is bearable for one patient may not be bearable for the other. So what we do is there are also some pharmacological methods and some non-pharmacological methods. Pharmacology, the most common one being we use epidural analgesia. These anesthetists are there around the clock. Patients are very happy with them. So one of the main things is that sometimes we also give opioids or NSAIDs or painkillers. That's also very good. Then another thing is non-pharmacological, that is a bath, that is a warm baths, or sometimes we also give them counseling. In the hospital where I worked in, we were using Entonox, that is patient-controlled analgesia. So there are ways, and also there is also what you call it, breathing techniques, which sort of distract you from the delivery. All these have good results, and we have landed up with normal deliveries after this. So basically, it's reassurance to the patient, and it's very good if the patient's partner also is there with us, assuring the patient of this.
Yes, I agree with you. And now there's another question. This lady says, I'm going to have a baby by C-section. So how soon will I be able to walk, and how
Walk,
soon will I be able to take care of the baby?
baby. Now, nowadays, what we all are following is something called ERAS, Enhanced Recovery After C-section. That is,
Mhm.
we do certain things that the patient gets better soon. We keep the patient fasting. We do, and after delivery, we make there are certain rules we do. That is, keep the patient fasting. We make her take fluids early. We make her ambulate easily. So all this help, and the patient is at least by the second day they start walking, and also early breastfeeding. All this we reassure their patients, and they are doing well, definitely. And these patients are able to care for the baby, because all these patients want to take care. The basic thing is a mother is waiting 9 months for her baby. So if because of this IRAS and all, very good results have found, and the mother even the second day is able to take care of her baby. She is able to walk and take care of her baby soon after the C-section.
And does C-section affect future fertility also in any way?
Actually, it doesn't affect fertility because that is not affected. But we have to tell the patient when we do the first time that we cannot go on having children. There is a limit. And also the deadly, as I told you, the placenta anterosus spectrum. We are so scared of these patients, isn't it, madam? It's a real nightmare.
Yes,
Even before we do them, and when they come, they really
yes.
nightmare till they get out. So we should tell the patients all these problems, but definitely their lives, the fertility is affected indirectly because of these problems.
Right. And another lady is asking, how do I prepare myself physically and also mentally for either type of delivery?
See, what I like to say is nowadays every we are following something called respectful maternity care. That is,
Yes.
every woman is being empowered to make decisions by herself. We are giving her enough knowledge, we're giving her the reassurance, and we're giving her the choice of what she wants. So patients are taking this in a very positive way. Even it's all over the world. Even the government of India has done a lot. What we do is we empower the patients. We have a what do you call a partner with her when she delivers. She's not
Yes.
allowed to deliver alone. She is there making decisions along with us. Every step we are reassuring her. We have midwives who are there on the clock. All these have made a lot of difference. And patients are being mentally and physically there. Her partner is there. Supposing we cannot convey what we want to her, her partner does it. So, like he's a sort of bridge between her and us. So, all these have come a long way, and patients are not getting scarred by the experience of childbirth. They are getting empowered, and these patients go out and give a positive impact. And each patient is treated with dignity and pride when they are undergoing. It's not a shame to have a baby now, or shame to be delivering in a maternity ward. So all these have helped patients go a long way.
Right. Very well said. So, this was the next question, that what role can my partner play during labor and delivery, or during
Yeah.
C-section? Besides hand holding,
Yep.
what all they can do?
Yeah. Nowadays, even partners go for the prenatal classes, and
Yes.
nowadays we encourage. We don't give episiotomies easily. Okay, we do massage of the perineum. All these partners
Yes.
also can be a part of, and they can be a bridge, as I told you, between them and the patient, and they pay a long way. So most of the times, even I work in the public sector, we are allowing husbands or mothers-in-law, if the husband not available, they do seem to help. Sometimes boomerangs on us, but they definitely seem to be helping and playing a big part, a big role in the child process of childbirth.
Yes, I agree about that. So, thank you, Professor Dr. Madhulatha Alexander, for joining us today. Could you show us the
Yeah.
certificate, please?
What, ma'am?
This this is a
Okay.
small
Oh,
token
thank you.
of respect from our side, that you came and you gave your precious time to us for this occasion. And I'm sure I have learned so many tips from you, and so would have the
Not,
women
ma'am.
who are going to have mothers, going to become mothers. And some mothers who had some doubts in their mind that they were not treated well during their labor, they would feel better after listening to you. So thank you, ma'am. That will be all for today. Dr. KK Med Talks
Thank
will
you.
return tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK Med Talks. Namaskar.
Thank you. Thank you.